love Laurie Saputo. She comes out from Ocala every month to give our healthcare students good advice and on their program choices. So, Laurie, what do you do typically when you come out here?
Well, Marilyn, thank you for having me. It's wonderful. I do like to be here once a month so I can meet up with all your students who are interested in the healthcare field. We have a lot of really nice programs, and we're growing. Health sciences continues to grow because there's a lot of sick people, and Florida's full of a lot of old people.
Yeah.
So our nursing programs, we have 3, and we're always interested in students who are looking to be in the healthcare field in a nursing profession, and some don't really know what they want to do yet, but we push them into things like med-surg because that's a great place to start with a nursing career so that people can explore and find out just what nursing is about. So they take prerequisites before being admitted to our programs, and that way they're looking at what kind of nursing would be best for me. You know, when they're doing their prerequisites, they have an opportunity as well to go out and do your volunteer work or to take internships. It's a really great way to start with the healthcare field. Those who don't want nursing might want something in the emergency medical services field. That would be EMT, paramedic, and then they can go on for an EMS degree. That's the excitement of it all. Those are the folks who like the rush and they want to be on the front of an accident, but then they drop off their patients and they don't see them again. With nursing, of course, it's more of a long-term commitment and ongoing, right? We have a surgical tech program that's a certificate program that's 1 year. And with the Surg Tech program, these students are coming to us for lecture, and then they're going over to the OR and they're learning how to become Surg Techs. Really great program for a year. These students are, they're offered many venues in terms of the different kinds of surgery that they might want to be involved in. There's one-day surgery centers, there are acute care facilities that have Surg Techs there, and of course there's the hospital always for them. So the dental assisting program has grown unbelievably. A lot of dental assisting.
Award-winning, I believe.
It is indeed. We're very proud of that. And Deanna Steniford is our award winner. She's done a wonderful job with that program. It is not a dental hygiene program, and that's important to distinguish between dental hygiene and dental assisting, because the dental hygiene program is a 4-year degree. They start off with that, and then they go on for usually master's work. And the dental assisting, however, is the 1-year certificate program where these students are invited to come and work with a dentist. They work with the health department over at our Hampton Center in Ocala, and it's a great program because they have hands-on from the very beginning. Then they go on for a degree if they'd like to. They take some general education classes, and they can actually have a degree in dental assisting. We have a physical therapy assistant program. Again, not to be confused with the physical therapist. Physical therapist has 4 years and beyond in terms of education, but they start off often with the physical therapist assistant certificate program. I'm sorry, it's a degree program, but it's a year and a half where they're going to that to work on further, to go to a 4-year college if they choose to do that. But the PTA program is run over at our Hampton Center as well in Ocala. And there are prereqs involved in that too.
Right.
These are limited access programs whereby you have to apply for the program before you actually begin, and then it's 18 months to 2 years beyond that.
Okay.
And we're pretty excited about the idea of a radiography program.
Yes, we
I'm
are.
not supposed to talk about that yet, but I'm going to.
Well.
There you go. These students are doing prerequisites before they get into a radiography program. Hopefully that will be starting in January of 2016. Very exciting.
It is exciting.
And radiography is a great field. And sometimes students will come to me and say, what would I be good at? I don't know. Tell me about your personality.
Right.
Tell me what you like to do. The radiography program is more about looking for diagnostics, whereas the nursing program is much more about caregiving. So
Healing.
you have to look at someone's personality and see what it would be, you know, in terms of a good fit. And wonderfully, we have a testing department with Mr. Benlolo over in Ocala. He will do testing services on these students who don't know what they want. They want something in health field,
But they don't know what.
Sure,
Yeah.
They don't know what they want yet.
So if a student wants to come and talk to you some more, how do they make an appointment?
Well, they call over here, extension 2104, and they
For those
set
of you in
up
the
a
outside
time.
world, that's
Yes.
352-493-9533.
They can call my office in Ocala as well,
Okay.
and I make appointments for them. I start at 7 o'clock in the morning, and I'm not opposed to meeting somebody really early in the morning. And I like to sit down and meet with a student to make sure that they know what they're getting into.
Sure.
That's one of the more important things, Marilyn, to me, is that people don't go the route of taking a lot of prerequisites and putting money, time, energy into
Right.
something and have it be not what they want at all.
Right.
So I'm a big proponent of go volunteer and go do some shadowing and all of that so that you can find out if this is what you want. And then I sit with a student and we go over prerequisites for the particular program they want. And beautifully, as much fun as this is, I've been doing this for 11 years. And this is the first time Levy has offered everything we need for things like
I know,
nursing
and that's an important
PTA.
point. All your
it's so
prerequisites
wonderful.
are
All
available
prerequisites
here.
are done here, right? They used to have to go all the way over to the it feels like so far away. It's only an hour, but they have
Yeah.
to go over there to
No
do all
more,
of this,
no
right?
more.
And now
We're-
it's all available
We're
right
very
here, so
pleased.
yeah.
Do they need to bring anything with them when they come to
When
see
they come
you?
to see me, just a smile. That's it.
Oh, we'll match them smile
That's
for
it,
smile.
Just a smile, and generally speaking, I can look up whatever I need to look up in terms of their
Okay.
records to see what they need, to see what else would be available to them. For like if they're wanting other classes. Suppose they've already been to Santa Fe. How much was transferred in? They have to know those things before they can
Right.
start using up, heaven forbid, their financial aid money on classes that they don't really need.
Well,
So we're careful about
I'm
that.
sure our phone is going to start ringing off the hook. Thank you so
Oh,
much.
it's been fun, and I'll continue to come on a monthly basis.
I know you will.
Thank
Thank you.